Hi friends, welcome to the Safe Path Veterinary Services. In this video, we are going to talk about an important disease of the feline family, that is the feline Panleukopenia infection in cats. If we talk about its other synonym names, that are feline infectious enteritis, feline parvoviral enteritis, feline distemper, feline ataxia, and cat plague. The etiology of this disease refers that it is caused by the feline Panleukopenia virus that belong to the single-stranded DNA virus group, and its family is Parvoviridae, subfamily is Parvoviridae, genus Protoparvovirus. It replicates in the nucleus and form intranucleus inclusion bodies. If we talk about its epidemiology, this disease is found in most species of the feline family, and these phalids are highly susceptible to the infection, which is generally endemic in unvaccinated cats. The cats of all ages are susceptible to this infection. The disease occurs in young, recently weaned kittens because of their maternally derived antibodies level declines when they are weaned. High rates of virus excretion occur during the acute stages of the disease, mainly via the fecal route, also in the saliva, urine, vomitus, and blood. If we talk about the environmental conditions that are favorable for the feline Panleukopenia infection, that is the cool, moist, dark environment is most susceptible for this disease. Fleas and humans act as a mechanical vector for this disease. If we talk about the pathogenesis, the feline Panleukopenia virus is excreted via the different excreta and is ingested or inhaled by the host species, and it mitotically and it divides in mitotically active lymphoid tissues of oropharynx and associated lymph nodes, and develop viremia systemically within the 24 hour, producing infection of mitotically active cells in the other tissue, particularly the cells of the intestinal crypts and the lymphopoietic cells of the bone marrow, thymus, lymph node, and spleen. Destruction of these target tissues result in the panleukopenia and villus atrophy. The crypts of the labor cone are dilated and contain necrotic epithelial cells. The intranuclear inclusion bodies are sometimes evident in the crypt cells. Intestinal villi become blunted and may fuse. The effect of the transplacental infection on the fetus generally relate to the stage of the gestation at the time of viral invasion and range from the cerebral hypoplasia and retinal dysplasia to the fetal death. It means if the mother is infected, then the fetus within the mother is affected, but depends on the stage of the gestation. It may cause the cerebral hypoplasia, retinal dysplasia, or may cause the death. Here you can see if the virus is going to affect the lymphoid tissues, it is called lymphoid hypoplasia and causing the panleukopenia. If it is going to affect the bone marrow, then it causes panleukopenia. If it is going to affect the fetal organs in the first trimester, it is called the fetal death, fetal resorption or the abortion, but in the second and third trimester, it will called cerebral hypoplasia and feline ataxia. If it is going to affect the intestinal epithelium, then it will cause enteritis. If it is going to affect the retina, it will cause retinal dysplasia, and thymus atrophy is caused by this virus. If we talk about the clinical signs, these include the bloody diarrhea of the GIT, severe dehydration, malnutrition, anemia, often death occurs. It causes the decrease in the cat's white blood cell, that is also known as panleukopenia. The general signs include the depression, lethargy, loss of appetite, fever, vomiting, usually yellow frothy, loss of skin elasticity due to dehydration, and self-biting in the tail, lower back, and back leg can be seen. Sitting posture of the cat is observed with the head between the stretched forelimbs. If we talk about the diagnosis, the tentative diagnosis based on the clinical signs that have been discussed above, the bloody diarrhea, the vomit, yellow frothy vomit, and the other clinical signs of the dehydration generally includes. And the white blood cell count of the you can say the cat is declined. Panleukopenia will take place. Neutropenia is more common than lymphopenia, and a rising body antibody titer may be detected in the serum samples by HAI and the VN. Commercially available canine parvovirus kits can be used. ELISA and PCR techniques can also be used. If we talk about the treatment, there are no specific treatment available for the parvovirus as a viral infection, but the supportive treatments can be used. Because of the diarrhea and vomiting, the cat will be facing dehydration issues. We can use the dextrose or the lactated linger solution depending upon the condition of the animal, and we can use the antibiotics related to the GI tract that can cover the secondary bacterial infection. We can use the metoclopramide for the control of the you can say emesis, and we can also use the astringent to cover the surface of the intestine. Affected animals should be housed in clean, warm environment and maintained on the optimal diet supplement with the B complex. You can say the diet should be soft forms. Diet should be used, and we can use the blood transfusion at the dose rate of 10 to 20 ml per kg per day, or at alternative days. There is also specific treatment that is a serum. We can use the serum treatment for the Panleukopenia if it is affecting a cat, but at the dose rate of 2 to 4 ml per kg body weight. This is limited because it can affect the vaccination status of the animal. If we are going to vaccine the animal later on, it will affect the vaccination status. If we talk about the control of vaccinations, the principal control measure modified live and unvaccinated, inactivated vaccines are commercially available. Modified live vaccine can be used to minimize the kittens at 8 to 10 weeks of the age with a booster dose. At 12 to 14 weeks of the age, we can give the first dose at 8 to 10 weeks and the second dose at the age of 12 to 14 weeks. Annual booster vaccination are recommended by the vaccine manufacturer. These vaccines should not be used in the pregnant fallows. That is all about the clinical signs, the treatment, and the diagnosis and transmission of the feline Panleukopenia virus. I think it is an informative video.